Morning, everyone. We'll give another minute or two for folks to join, and then we'll jump right in. All right. So 9 o'clock Pacific time, in the interest of respecting everyone's time, we'll jump right in here. Thanks, everyone, for joining this morning. My name is Casey Neathway. I'm the National President of CIPHI. And today is One Health Day internationally. So we wanted to host a session to talk a little bit about One Health and the context of the work that we do as environmental public health professionals in Canada, and share some of the learnings from the International Federation of Environmental Health One Health conference that was held at the beginning of October, so pretty recently. So I'm just going to share my screen here and then we'll just get started. All right. So I still see a few folks trickling in here, but we'll get going here. So a little bit of our overview for this morning. We'll go through an introduction to One Health. We are going to talk about the importance of a multidisciplinary approach in the work that we're doing, the relevance to the Canadian environmental public health landscape, and then look at some of our partnership opportunities as CIPHI, both in our current work, what we're doing now, and future work as we continue to move this forward. So this is the definition of One Health from the World Health Organization. One Health is an integrated, unifying approach to balance and optimize the health of people, animals, and the environment. And so really what that means is that there's an intrinsic link between the health of humans, the health of the environment, the health of animals, and of plants as well. In 2007, that was kind of the first time that the One Health approach came to the forefront. So it was recommended for pandemic preparedness at the International Ministerial Conference on Avian and Pandemic Influenza. And so back in 2007, we were seeing, of course, some respiratory illnesses, some pandemics there, as well as some H5N1 and various other animal-related diseases. And so the concept of the interrelatedness between human and animal diseases and the health of the environments and people and animals was really at the forefront at that time. So that's kind of where the One Health concept started to get traction. But historically, this has been an understanding of people and cultures for decades, for millennia, knowing that there is that linkage between the health of the land, of the people, of the animals, and that interconnectedness. The approach has been adopted by the World Health Organization, the Food and Agricultural Organization, the Canadian Food Inspection Agency. It's really an approach that has been adopted by governments across the world in approaching public health. So we have some really tangible and recent examples within Canada of that relationship between human, animal, and environmental health. And I pulled these up a couple of weeks ago, so there may be things even more recent than this. Avian influenza, I'm sure many of you are aware that across Canada, we are currently experiencing a pretty widespread outbreak of avian influenza. Currently, as of when I put this slide together, there were 21 farms under CIPHI quarantine. There was another 2 to 4 farms at that time that were actively being investigated, so that number kind of might have been raised. Rabies in 2019, there was a human fatality in Victoria, British Columbia, or on Vancouver Island, about 6 weeks after a man handled a bat. He passed away from rabies. Lyme disease in 2021, there was over 3,000 cases, which was the most ever tracked in Canada at that time. And then compare that to 2009, when there was just 144 cases in Canada. The first case of West Nile virus in a human in Canada was in 2001, and there was 47 cases of West Nile last year. So that's 2022 in Canada. We're seeing increasing bloom frequencies and severity of harmful algal blooms, both in marine waters as well as in fresh waters. In 2009, there was 4 cases of bovine tuberculosis, which was a strain that had never been before seen in Canada and the United States. And we're also seeing some increases in chronic wasting disease in cervid populations as well. So as of last year, it was a 23% case positivity rate in mule deer in Alberta. Whitetail deer were a little bit lower than that, but that's based on the samples that hunters had submitted. So, more than 1 in 5 mule deer that were sampled were positive for chronic wasting disease based on that test. So when we look at the approaches to One Health, it really becomes clear that a multidisciplinary plan is required for success and for protecting public health. Each partner, each collaborator, each profession within this space has their own scope of expertise. We have the veterinarians, whether they're domestic or wildlife veterinarians, who have that expertise in animal health, ecologists who can really monitor changes to the landscape and the environment and see how those are impacting plant and animal and human health, biologists, physicians, of course, for the human health side of things, and then the role of environmental public health professionals as well, which of course is why we are here and what we'll highlight throughout this morning. There's also evidence that solutions based on that multidisciplinary approach are most effective. And so when we're talking about solutions, it really is about decreasing the burden of disease on humans and increasing the health of the population as a whole. So when we consider the interactions between human and animals and environmental health, you really do need to look at things like, where animals are traveling and how that's being impacted by environmental conditions, how those animals are interacting with humans, how they might be driven out of their traditional habitat, being brought closer into urban settings, for instance, how animal biology might lead to the disease spread and what changes in the environment are contributing to that. We know that early detection and response can be supported through ecology mapping and those monitoring of environmental changes. So when we go back to that kind of first bullet point about who all the players are in the One Health approach, it is really important to consider not only the biology side of things, the human health, the animal health, the plant health, but also looking at the interactions between all of those pieces from an ecology perspective and the importance of environmental specialists or even folks with expertise in things like GIS mapping, where we can really look at these changes to the environment and how they might be impacting these interactions. When we look at environmental public health in Canada and the role of environmental public health professionals in that One Health approach, really, we are the foundational piece of bringing all of these different players together. So environmental public health professionals have the role of the assessment of environmental risks. Of course, there's a foundational piece of inspection of facilities or regulated premises and providing advice and guidance there. We have CPHICs who work in disease surveillance and epidemiology. And then I think what we really do well is that public education awareness and knowledge translation. So, as a profession, our role is to bridge the knowledge gap between the public and the health sciences that we work in. So, a lot of this could be as simple as when CPHICs are doing those inspections in facilities, being able to translate that information and the knowledge on what they see and the contributors to public health outcomes to the operators, but can also be really valuable in developing those education campaigns for the public, for the lay people, the community members who might be going out into the woods, on things like tick awareness, as an example. And then again, translating that scientific data, that knowledge that environmental public health professionals have into policy development and creating a better framework for policies and guidelines on how governments can control that interaction between humans and animals and plants and the environment. So again, as environmental public health professionals, we are really uniquely situated to understand those human and environmental interactions and how those can contribute to various public health outcomes. Have a few kind of specific case studies here on both One Health incidences or the One Health approach to various diseases, as well as how we are starting to see a changing climate increase of frequency of these. So the map on the right is the near future. So the map itself is a couple years old. So near future in this case was 2021. We're really looking at the spread of the black-legged tick from its kind of, I'm going to say, starting point and how it's broadly spreading across Canada, or will be broadly spreading across Canada over the next few years. Locally acquired cases have been steadily increasing since 2009. So the graph on the bottom left there shows those locally acquired cases in the dark red, and then the outside of Canada ones are the kind of the pinkish color. But you'll see over time that's been increasing at a pretty steady rate. With regards to the map, it doesn't show British Columbia on there for some reason, but absolutely British Columbia is, just as at risk as the spread of, or for the spread of black-legged ticks as any of the other provinces along the lower 49th parallel there. So with Lyme disease, of course, there's no human-to-human transmission. So those cases on that graph that we showed are solely attributable to that interaction between humans, the vectors, so the ticks, animals, and the environment themselves. We are seeing that warming climate lead to a greater geographic distribution of the black-legged tick. And there's a significant number of roles that environmental public health professionals can play in Lyme disease management. So in some jurisdictions, they're doing tick surveillance. I'm not sure if this is happening where you are or what the role of environmental public health professionals are, but it's certainly a big part of Lyme surveillance in other parts of the world. Human epidemiology, so tracking those cases and supporting the actual human case control, the public health and outreach and knowledge translation, which I talked about earlier, as a bit of an area of expertise and specialty for our profession. And then looking at things like more upstream approaches, so advice on land management plans and what is contributing to those human and environmental interactions, and how people are going out into the grasslands and experiencing those ticks, and how we can better support interactions between humans and the landscape to reduce those risks. And then, of course, going back to that One Health approach and the importance of a multidisciplinary task, how we can partner with folks like veterinarians and ecologists to provide a more comprehensive landscape on this. Next, I want to talk a little bit about food safety and food security. So recognizing that animals are a reservoir, potentially could be a reservoir for foodborne pathogens and those foodborne zoonotic diseases, looking not only at the, more acute spread of disease or those acute zoonoses from the animals, but also looking at how these diseases can impact food security. So when we're looking at things like the impact to wildlife and consider the importance of a lot of those animals as part of traditional indigenous food systems, wild food systems, country food, however we want to frame that, it's not just the risk of disease, but it also goes back to the scope and scale of the animal disease within these populations and how that can really impact a community who relies on these as food items. So talked about chronic wasting disease in cervids, so the deer, moose, elk populations, and the 23% test positivity rate amongst mule deer in Alberta. There's no evidence yet that chronic wasting disease can spread between cervid populations and humans. But there was a study a few years back now, 3 or 4 years back, where they showed that it was they were able to infect monkeys by feeding them contaminated materials from infected deer. And so, given our shared biology with monkeys, certainly there is a high enough risk there that the advice and guidance to populations is to avoid those materials that might be contaminated or infected. Similarly, this potential spread of bovine tuberculosis from domestic cattle to cervid populations has been a risk. So back in 2019, where there was that case of bovine tuberculosis at a farm in British Columbia, there's a lot of engagement with local Indigenous and First Nations populations on really monitoring and assessing the risk to the deer populations that were being hunted at that time. And again, the risk of disease spread there to humans who are participating in those activities. And then a little bit more coastally, looking at the increase in harmful algal blooms and the decreased ability for coastal populations to harvest those shellfish safely for food consumption. We also saw a few years back, of course, the cases of Vibrio cholera in herring roe on the coast of British Columbia. And so when we look at this as, as a combined risk factor for humans, again, it's not just those specific diseases themselves. And, I may have handled a contaminated piece of meat or consumed some infected deer meat, and then I'm at personal risk, but it's also more of a sociological and ecological risk around food security and populations that have already seen a lot of their traditional food sources impacted by colonial activities, and now this adds an additional stressor onto that. So as environmental public health professionals, our contribution to ensuring a food safe supply isn't just those downstream inspections, not just that acute part, but also those upstream assessments as well. So really looking more holistically at those interactions between human and environments, looking at some of the monitoring pieces, and looking at population health as a whole and how we are supporting systems that are safe and sustainable. I've alluded quite a bit kind of throughout the past 20 minutes or so on the role that a changing climate is having on these interactions between humans, animals, and the environment. But it really is quite acute and noticeable. And each year we are seeing more and more indicators of this. And I'll go through a few examples on some future slides. But it really boils down to, as temperatures are increasing, the range of those vectors is increasing as well. And so as climates get warmer, things like ticks and mosquitoes that prefer warmer climates will, continue to spread to those new areas that are open and livable for them. We also know that precipitation and moisture changes can affect vector habitats or life cycles. Again, if you think of something like a mosquito that requires that pooled water for its eggs, if you have more precipitation or a wetter climate, there's going to be more areas where they're able to reproduce. I talked a little bit about the increasing harmful algal blooms and how those are being contributed to by increasing water temperatures. We're seeing increasing seawater temperatures, of course, that create more favorable conditions for the algae to both bloom and produce the toxins. And then there's the concept of some of the more acute environmental emergencies, things like wildfires and floods that push animals out of their natural habitats and or completely destroy those natural habitats and bring them into closer contact with human populations. So 2023 was the worst ever wildfire season in Canada. And so when you think of all of those animals that traditionally, would have been in the woods and kind of, staying out of the way of humans, now there's a lot less territory for them to be in, which just increases their ability to interact with human populations. And just on the broader scale, those altered habitats can just overall impact biodiversity and ecosystem health. If we think of, our country or the globe as a as a well-oiled machine that's based on specific interactions and biodiversity. And now we're starting to adjust some dials and change a lot of the factors that are contributing to that. We're just going to see an overall change to the health of the ecosystems. And so as we see increasing disease or decreasing health of animals and plants and the ecosystem or the environment as a whole, that of course translates to increases in human disease as well. So a few examples, and these are very, very recent within this year, 2023, that are really indicating how a change in climate is leading to increased animal and vector and human interactions. This is from Baltimore, so the DC capital region of the United States, had their first case of locally acquired malaria this year. So individuals in the hospital recovering, but when you think of malaria, you don't really typically think of the United States, and if you do, it might be more kind of the Florida area, which we'll talk a little bit about here. But the fact that it was in the capital area of the United States in the DC, Maryland part of the world was just really an alarm bell on how quickly these types of diseases are spreading more north. In Long Beach, California, this is just from a couple days ago. There was a confirmed case of locally acquired dengue, the first one that I've seen on the West Coast in California. So again, like, fairly southern California, southern United States, but still a lot more north than we would typically expect to see something like dengue. And then I referenced Florida. Throughout this year, Florida has seen a number of cases of malaria and dengue. I think maybe we would expect this a little bit more in Florida. It's hot, it's humid, it's warm. But even that, this is new. This isn't something that we've seen 5 years ago, 3 years ago. This is really a key indicator that our new normal is a lot of these diseases that we would typically consider to be tropical, moving north into our continent, into North America, into places that are fairly close to us geographically speaking. And then you'll also see in the text there's also a locally acquired malaria case in Texas this year as well. So moving on to kind of the collaboration and stakeholder engagement, now that we've set the stage a little bit for what this all means and why the One Health approach is important. CIPHI had the opportunity this year to partner in the International Federation of Environmental Health America's Group One Health Conference. That was in Montego Bay, Jamaica at the beginning of October. And the second conference of its kind that was hosted by the IFEH Americas Group. So the Americas Group is made up of us, CIPHI, the National Environmental Health Association in the United States, and then the Jamaica Association of Public Health Inspectors in Jamaica. So that's why it's held in Jamaica. The last conference was, I think, 2017, and then they'd been planning a subsequent one, and COVID derailed things, as COVID tended to do. And so 2023 is when we have the second one. So CIPHI was a part of the planning committee. We're very involved in, making this event happen, and then we're able to participate at the conference. So The picture on the screen there is myself in the middle, along with Dr. Henroy Scarlett, who is the president of the International Federation of Environmental Health, as well as a former Jamaican Association of Public Health Inspectors president. And on my right, or to the left of the picture, is Dr. David Dijak, who is the executive director of the National Environmental Health Association. And at the podium is Gary Brown, who's a past president of the National Environmental Health Association. And we really had the opportunity to collaborate and talk about some of the shared areas of interaction between our work and the commonalities that we're seeing in how we partner and how we approach this work, and how we can learn from one another as well. So going back to those examples of things like dengue and malaria, that are now starting to move up into the United States, there's absolutely some learnings there that we can take from our partners in more tropical areas of the world who might have been experiencing these things for decades, and have some good learnings. One real takeaway for me from interacting with our partners was how frequent and how common it is for a lack of awareness of the role of environmental public health professionals. I think my assumption was this was a pretty uniquely Canadian thing, where our role, our function, our work was under-recognized, underutilized, maybe needed a bit more advocacy work. But the more we've started working with and talking with partners over the past 5 years or so, the more that it's become evident that this is I'm going to say a systemic challenge, or a multi-jurisdictional challenge, in raising that advocacy and awareness of what it is that we do. As a, I think, specific example, the country of Jamaica was able to, through a lot of their work, convince the government to increase the number of PHI positions to 500. That was kind of their target number, was 500 public health inspectors for a population of about 3.5 million in Jamaica. So they've done a good job recently of really working with their Ministry of Health to highlight the importance of work that they do, and I think similarly are really looking at some of the advocacy work that CIPHI has done to support them in their missions as well. And so those are some of the similar challenges that we're seeing across our organizations, is how do we create a space to work together when not everyone knows that we exist or what it is that we do. So that leads into some of the challenges and opportunities with this work around One Health. So there needs to be that increased awareness of roles and responsibilities. I think not just within CIPHI, but between CIPHI and other agencies as well. So do partners know what CIPHI members do? Do public health veterinarians, or the infection control folks who are working in the labs, do the physicians know what our role is, and how we interact in this One Health approach when they get presented with something like a Lyme disease case? Internationally, nationally, locally, provincially, how can advocacy improve One Health approaches? So how can we utilize some of our ongoing CIPHI advocacy work around the role of environmental public health professionals and what it is that we do in a manner that leads to better interactions with our other professional groups who are in this space and working through these One Health approaches? I think we have a bit of an opportunity, but also a current challenge around public awareness of both the impacts of human, animal, environmental, and plant interactions, and a changing climate. I think we're starting to see a better acceptance maybe from the public that we are experiencing a changing climate. Parts of Canada are getting warmer, parts of Canada are getting wetter. We're seeing more extreme weather events. And so, the need to foundationally create a space of awareness of those increased risks associated with a changing climate is really predicated on people accepting that there is a changing climate. So I think we're making some progress there, but part of our education as well is communicating that piece. There's certainly a need for more data mapping information. I kind of referenced folks like GIS specialists previously, but really crossing those boundaries between some of the soft sciences, social sciences, whatever you want to call them, and the more acute public health side of things is important to be more proactive on this and less reactive. So that future mapping of the black-legged tick area was a really good example of how we can utilize a lot of this data informatics to create better education campaigns where things might happen in the future versus just waiting to capture the tick. Or I think back to the kind of mid 2000s when we were doing all that mosquito surveillance around West Nile, and it was really capture the mosquitoes and see if they have West Nile or not. And then once once a case has existed, then a lot of that mosquito monitoring in various parts of the country just ceased because it was there already. But I think there's that good opportunity to be a little bit more upstream and proactive and working with our partners in how we plan for the next risk, not just respond to the one that's facing us right now. And then a really good opportunity, and I've talked about this a few times, of course, is a multifaceted skill set of environmental public health professionals. So, what we are able to do across the whole spectrum of human health and increasing that knowledge translation and awareness is really a space where we can step into this One Health approach and contribute pretty deeply. So looking into the future direction, both for CIPHI specifically and then beyond that scope, I know that we are going to continue our partnerships internationally, not just at the kind of immediate border side, so our NEHA or JAPHI friends in the United States and Jamaica, but also internationally as well. So we have some really good lessons that we've learned in Canada. We have a really strong space of advocacy and a really strong skill set. I like to think that we have one of the strongest programs for both certifying and developing environmental public health professionals in Canada through our Board of Certification and our professional development model that keeps folks on top of their skills. Uh, and we can share a lot of that knowledge base across organizations for a more global framework of environmental public health and a more holistic view towards the One Health approach. Participation in One Health related committees internationally, again, going back to the recognition of Canada as a strong leader in this space, we really have the opportunity to start participating with some of these other organizations, whether it's NEHA or the International Federation, or really sharing those skills outside of our borders. And we can support our environmental public health partners with fewer resources. So a really tangible example that came up just last week as we were on the International Federation of Environmental Health annual general meeting, and the folks from Ghana literally didn't have the $200 for their IFEH membership. And so if you think of how privileged we are to be able to really create these strong spaces of education and awareness and building up our population of environmental public health professionals to stand into this work and address these new and emerging diseases and challenges. There's a lot of information and knowledge and support that we can share with our partners globally who might have the knowledge and skill set, but don't necessarily have all the resources to address some of the things that we are just now facing. And then looking closer to home within our own borders, that continued advocacy piece. So CIPHI is now in our, I guess, just wrapping up our second year of advocacy campaigns for the public, for our partners to highlight the roles that we play, the work that we do. And then looking as well a little bit more locally at those organizational level connections with our One Health partners. So, if your province, if your health region has public health veterinarians or, communicable disease units that may or may not include environmental public health professionals, starting to build those relationships in a way that recognizes that the One Health approach is truly multi-jurisdictional. Participating in knowledge exchange and research activities, whatever that looks like for you or for us as CIPHI, to really get our knowledge and get our awareness and get our expertise into the public domain in a way that supports the overall improvement of public health. I'm sure many of you, some of you have heard about the work that's happening on the core competencies with the Public Health Agency of Canada, and I'm going to say improving or modernizing those since they were last done in 2008. And we're really happy, really privileged that CIPHI has a seat at that table to advocate for those core competencies which align with our professional skills and knowledge base. And then, what CIPHI will commit to doing is continuing to raise the profile of environmental public health professionals. It is one of our core 3 pillars of our governance work, along with education and our governance. And so that advocacy piece is really important. It helps, get us involved, but also things like increase the number of positions that are available for CPHICs and increase the wages for those individuals who are already in those positions. Going back to the Jamaica example of, their 500 members for a population of 3.5 million, that's about 6 times the ratio of certified health inspectors that Canada has right now. So I think we can also learn from our colleagues internationally as well about the type of advocacy work with governments that we can do to increase those positions, and then looking at retention and retaining those folks who are already in those roles. And so just to wrap up with some conclusions and calls to action for all of you here. So we are experiencing a current reality of more human, animal, plant, and environmental interactions leading to human illness. The data is there that we're seeing increases in things like Lyme disease and West Nile cases in humans. We know that a changing climate is currently and will continue to exacerbate these interactions as vector areas get larger, as climates get wetter. The One Health approach can bring together the subject matter expertise from multiple portfolios to protect the health of all Canadians, whether it's us, whether it's the physicians, whether it's the veterinarians, the ecologists, or some of those social scientists who can really contribute to this work. And as an environmental public health professional, you have an important role in this work as well. So you can identify those partners who work within your jurisdiction, your geography, your ecosystem, and start to build those relationships. And you can continue to be a strong voice for the environmental public health sciences and its importance in this type of work. And so we'll close there, and we do have a few minutes for any questions or discussion that folks might have this morning. So question in the chat, do you have a sense of how many governments or agencies in Canada are actively using the One Health approach? I know there was content at the New Brunswick AEC referencing One Health. Yeah, great question. And it seems to be varied across jurisdictions. And so we have seen some really good examples on the East Coast. So I think both New Brunswick and Nova Scotia are really taking some good approaches here. In British Columbia, we have had an ongoing One Health conference every year that's hosted by the BC Centre for Disease Control. And then I think we're starting to see as well, as the awareness and as the incidence of some of these diseases in animals increase, almost a forced recognition of the need for that One Health approach. So going back to things like the chronic wasting disease that's happening in Alberta and the roles of environmental public health professionals and some of the knowledge exchange pieces there. And so I think, don't have a strong sense of each jurisdiction or individual region and where they're at, but I think I've certainly seen a national perspective on increasing those interactions between the different portfolio areas, almost out of necessity, as opposed to that proactive planning. Yeah, Lydia.
Hello, hi everyone. Thank you for allowing me to ask a question and to ask it with my video on. I'm so excited to be here. And I want to send Casey a follow-up email because I don't know if folks here are aware, but we are engage and undertaking a One Health 2.0 project at the NCCEH. Last year, we did some work, and I don't know how many of you have ever seen our primer on One Health for environmental public health professionals, but this is so opportune to reach out to all of you, because by virtue of you being here, it means that you are absolutely relevant to our cause of being your knowledge translation support. We are trying to, at the moment, we're undertaking the work of scanning the Canadian landscape of who is doing One Health and what does doing One Health mean. So we're trying to bring that Canadian context forward. And then we want to then quite soon jump into conducting key informant interviews with yourselves, for example, and to bring that practical lens to, all right, what does all this mean? And when I saw that case study that you showed, Casey, is one of many. I also think that this is an opportunity to let you folks know that we have knowledge translation resources produced on ticks. We have a national mosquito working group that's very active. And this is not something that we publicize because we want to have a very focused community of practice around mosquitoes in Canada in general. And we have government representatives, municipality representatives, and there are practitioners as well. So that's another opportunity to come in at a vector level. So I won't go into too much more detail, except to just kind of put in a commercial right now to let you know that the NCC is very much in this lane, and would love to hear from you, perhaps through Casey. So thank you very much for letting me speak up.
Oh, thank you, Lydia. Glad you were here, and I have posted the link to that primer into the chat as well, so folks have that. Fantastic resource.
More to come. Thank you.
Yes, and certainly do want to reiterate and highlight our fantastic relationship between CIPHI and the NCCEH. So as of this year, we now have one of our CIPHI national executive reps sitting on the advisory board of the NCCEH. And really, as Lydia alluded to, they're such a great resource for knowledge translation and supporting the field work that environmental public health professionals do. And so the more that we can work in partnership and raise that that profile and that ability for us to partner, the better we all are. Okay. Seeing no more questions, we will close for the morning. I would like to thank everyone for taking the time to join us here. If you have any questions that pop up or do want to connect with the NCCEH or Lydia, just shoot me an email, president@ciphi.ca, and looking forward to continuing partnership in the future as well. Thanks, everyone.